Good afternoon. As a province, we can be proud of how we have worked together to limit the spread and impact of COVID-19 in the last 3 months, but especially over the last 24 hours. Yesterday, I reported 3 new cases. And today, I'd like to update Islanders on the results of our work in response and what we've learned in the last 24 hours. I'd like to reiterate that cases I reported on yesterday are not related to seasonal residents or the Atlantic bubble. All of the cases were related to island residents and in some way related to travel outside the province. So to recap from yesterday, one case was an essential worker who traveled outside of Atlantic Canada. And the other 2 cases, a man in his 20s who traveled to Nova Scotia and had contact with an individual who had recently traveled from the US, and a woman in her 20s who is also a close contact of the case. And she is a staff member at Whisperwood Villa. I'd like to provide an update on the situation at Whisperwood Villa. 129 residents and 140 staff were tested yesterday, and all results have come back negative. Visitors who were at Whisperwood Villa on Tuesday, June the 30th, are being contacted to arrange for testing today. All Whisperwood Villa residents and staff will be retested between July 8th and 10th, so later this week. I know Whisperwood Villa has been contacting families and loved ones of residents to inform them of the situation and answer questions they may have. And we continue to work closely with Whisperwood Villa in response to this situation. And I know the Department of Health and Wellness is working with them as well to make sure that they have a supply of personal protective equipment that they need. The woman in her 20s who tested positive and works at Whisperwood Villa identified 9 close contacts. All of these contacts have been tested and are negative, and these 9 contacts will remain in self-isolation for 14 days and will be contacted daily by public health. I know it has been a stressful time for residents, family, and staff of Whisperwood Villa to undergo testing for COVID-19, and we're taking every precaution to protect residents and staff of Whisperwood Villa, and keeping them safe is a top priority. I'd like to thank the team at Whisperwood Villa for their quick response and continued efforts to keep their residents and staff safe. And I'd also like to recognize the diligent work of those who carried out testing at the clinics and at Whisperwood Villa, and also staff at the QEH lab. One of the positive cases from yesterday, a man in his 20s, had 5 close contacts. 2 of these contacts have tested positive in the past 24 hours. This means we have 2 new cases to report today. Both are also men in their 20s and residents of PEI. These 2 individuals will remain in self-isolation for 14 days. As a further follow-up from yesterday, the male in his 50s who traveled outside Atlantic Canada has been self-isolating since his return, and he has 1 close contact who is also self-isolating. So to summarize, we have a total of 5 active cases in the last 48 hours, 3 confirmed yesterday and 2 confirmed today. We are experiencing a cluster of 4 cases that appear to be related to travel to Nova Scotia and contact with an individual who had recently arrived from the United States. At this point, there is no evidence of community spread of COVID-19 in our province, and the risk of transmission of COVID-19 within the province remains low. Over the past 24 hours, we have conducted extensive contact tracing. As I mentioned yesterday, contact tracing within 24 to 48 hours of diagnosis is key to contain the spread of COVID-19. The contact tracing for the cases I announced yesterday was completed within 24 hours. And today, public health staff will be doing the contact tracing for the 2 new cases. The QEH lab processed a total of 406 swabs yesterday. This was a record high number of tests for PEI processed in one day. Since the start of the pandemic, Prince Edward Island has had a total of 32 cases of COVID-19. We are taking every precaution to limit the spread of the virus in our province. Our system has the capacity to respond effectively and efficiently to this cluster of cases, and our response protocols have really worked well in this situation. We can be reassured that our health system is prepared, coordinated, and responsive, and that includes acute care, primary care, long-term care, public health, and island EMS. We have all observed instances where people are not maintaining physical distancing and observing the public health guidance. Maybe larger family gatherings, grocery stores, and retail outlets. But this cluster of cases is a clear reminder that COVID-19 is still very much present in our province, and we must remain vigilant. We must continue to be cautious and careful and stick to the basics. I said it yesterday and many times, but we should keep our circle of contact small. Physical distance, staying 6 feet apart, and if this is not possible, wear a non-medical mask, washing our hands frequently, staying home if you're not feeling well. And if you have symptoms of COVID-19, please call 811 and arrange to be tested. And do everything you can to self-isolate away from others and follow self-isolation guidelines if you're feeling unwell or you're returning from travel outside Atlantic Canada. Since the pandemic began, we have seen heartwarming acts of kindness, humility, integrity, and generosity. But as Premier King mentioned yesterday, we are each responsible for our own actions. And even people in a low-risk category are responsible for making good choices to protect their health and the safety of others. Our actions affect others, and everyone is susceptible to COVID-19. But the actions of Islanders have shown us why we all love this special place here in PEI. So let us continue to look after each other. Let us continue to make good decisions. Let's continue to be patient and kind. Thank you. And so I'll open it up, I think, for questions for the Premier or myself.
Travis Kingdom, CBC.
Hi, yes, Dr. Morrison, good afternoon. I was wondering if you could tell me any more about the case that came from Nova Scotia and as to why that individual did not self-isolate and kind of the purpose of their travel to that province.
Hi, Travis. We have been in touch with Nova Scotia starting yesterday and also called to them today. So they're very interested as well in some of the details of that individual and are following up with that individual in Nova Scotia. I'm not entirely sure all the details, but we will be working with Nova Scotia, and we're planning to have a conversation with our team here in PEI and Nova Scotia later this afternoon.
For you, could you tell us a bit more about how these two new cases came into contact with the case that they were exposed to, and does this worry you at all about potential for community spread?
The two new cases that we announced today were close contacts. For instance, when we name close contacts, it means that they have spent considerable time together in the same place. So knowing the circumstances of the cases that we announced today, they were close contacts. We will be following up to make sure that any additional contacts they have are also tested and followed up. But we're pretty comfortable that these close contacts were identified because of the time spent and where they live.
Jillian Kessler-Demour, Canadian Press.
Yes, hi, good afternoon. I was hoping you could maybe elaborate a little bit more on the level of contact and communication you're having with Nova Scotia to really trace kind of how this happened and what the status is there.
So I think I'll just, I've had email contact with the Chief Public Health Officer, Dr. Strang. I spoke with the Deputy Chief Public Health Officer, Dr. Gaynor Watson-Creed, and there's been communication between our two epidemiologists, so that work continues.
Okay, great. And in terms of the testing at Whisperwood Villa, how many additional tests do you anticipate doing? I know you said there'll be retests on later this week. Other family contacts. If you can elaborate on the testing.
So for instance, 140 staff, there remain 4 or 5 staff that did not get tested yesterday, and we are hoping that they will be tested today. And all residents but 2 were tested, and they will hopefully be tested, and they are on additional precautions at this time. And so all those same people will be retested again next week, or at the end of this week.
Laura Rigaud, La Voix acadienne.
Bonjour, Dr Morrison. Est-ce que vous pourriez juste nous réexpliquer en français quels sont les 2 nouveaux cas positifs à Lille, ce que vous avez expliqué tout à l'heure, s'il vous plaît?
Bonjour Laurent, on a 2 cas et ils sont en leur 20e âge à peu près, et puis ils sont des contacts d'un des cas hier, qu'on a annoncé hier. Et puis, ils vont bien, ils sont chez eux. Et puis, ils vont être auto-isolés en isolement pendant 14 jours. Et puis, on va les appeler chaque jour. Et nous sommes en train de les parler aujourd'hui pour voir s'ils ont d'autres contacts. Et puis, si on nomme des contacts, on va les tester aujourd'hui.
Bien, j'ai une autre question à laquelle vous avez, je crois, déjà répondu en anglais. Ce nouveau cluster de 4 cas est donc lié à une personne qui était en Nouvelle-Écosse et qui a rencontré quelqu'un qui venait des États-Unis et qui est revenu à l'île du Prince-Édouard. Est-ce qu'on en sait plus aujourd'hui sur comment cette personne a pu revenir à l'île du Prince-Édouard sans être mis en isolation?
OK, c'est important de clarifier parce que la personne des États-Unis n'est pas revenue à l'île du Prince-Édouard. Et il n'est pas ici, mais ils sont les contacts de ce monsieur qui sont ici à l'île du Prince-Édouard. Et parce qu'ils sont résidents ici de l'île du Prince-Édouard, ils peuvent toujours retourner à l'île du Prince-Édouard. Alors, ils pouvaient traverser le pont parce qu'ils sont les résidents de l'île du Prince-Édouard. Alors, c'est pas le monsieur qui était aux États-Unis qui est venu à l'île du Prince-Édouard.
Wildenette Paul, Radio-Canada.
Merci beaucoup. Bonjour, Dr Morrison. On a parlé des nouveaux cas en ce moment. Vous en avez rapporté 2. Pouvez-vous nous expliquer en français, en ce moment, quel est votre niveau d'inquiétude pour une transmission communautaire à l'île du Prince-Édouard?
Bonjour, j'ai toujours un niveau d'anxiété à propos de transmission communautaire, mais on sait depuis 2 mois, on teste beaucoup de gens ici à l'île du Prince-Édouard. On teste presque n'importe qui avec les symptômes. On on teste les personnes qui qui voyagent international. Alors, je suis toujours un peu inquiète à propos de la transmission communautaire. Et puis, je suis un peu moins inquiète aujourd'hui parce qu'on vient de faire tester un grand nombre de contacts des cas. Ils sont négatifs. Il semble qu'à ce moment, ils sont reliés, mais j'espère d'avoir on va faire des tests aujourd'hui si on a d'autres contacts. Et alors, j'ai toujours un peu d'inquiétude, mais c'est un bon moment de faire impressionner l'importance qu'on fait jamais quand ça va être ici. On sait jamais le contact avec les autres. Alors, c'est pour cette raison les mesures de santé publique sont tellement importantes. Garder la distance physique, de laver les mains, rester chez vous si vous ne sentez pas bien.
Merci. Une autre question pour vous, Dr. Morrison. Est-ce que vous pouvez nous expliquer combien de tests qui ont été faits à la villa? Quels sont les résultats de ces tests-là et quelles seront les prochaines étapes pour le foyer de personnes âgées?
OK, au foyer de personnes âgées, on a fait 140 tests pour les employés et 129 pour les résidents. Et puis, ils sont tous négatifs, mais ils vont être répétés pour juste s'assurer, encore une fois, plus tard cette semaine. Alors, on va répéter tous ces tests. Et il y a seulement 4 ou 5 employés qui vraiment ne sont pas testés à ce moment. Et puis, j'espère qu'ils vont être testés aujourd'hui.
Merci.
Jason Malloy, The Guardian.
Good afternoon, Dr. Morrison. Can you provide any further details on sort of the timeline from when the person went to Nova Scotia and the nature of that trip, and then the return to PEI?
Yes, my understanding from what we have learned, they went to Nova Scotia on June the 26th, and they returned on June the 29th. And it was not for essential travel. It was personal.
And secondly, just with, it's been a long time since PEI's had a confirmed case. The people that are doing the contact tracing, are those people that are doing other things during this time, or are these people that are being called back in when you get new cases?
The contact tracing is being done by public health nursing, and they do a really good job at it. And they do contact tracing all year for different things. They've done our contact tracing for other previous cases of COVID-19, but they also are well trained in doing contact tracing for our communicable diseases and our vaccine preventable diseases on a regular basis.
And did I understand correctly that you'll be doing the test or the tracing with the 2 new cases later today to determine if there's more tracing that has to be done to ensure people that may have come in contact with the new cases get tested?
Yes, that conversation started this morning. I spoke to both cases late last evening, and then our procedure really is that then the public health nurses will have more detailed conversation starting this morning, and then that process will start. And I think it was underway early this morning.
Thank you very much.
We'll now open it to additional questions from members of the media.
Dr. Morrison, vous avez parlé qu'aucun test positif sont revenus jusqu'à présent du foyer de soins pour personnes âgées. On le sait à quel point ça peut se transmettre rapidement dans ce type d'établissement. Juste nous dire, est-ce que ça a été un soulagement pour vous? À quel point ça reste une inquiétude en ce moment pour le foyer?
Oui, ça reste une inquiétude, mais c'est moins qu'on a tellement de résultats à ce moment que les premiers tests sont négatifs. On va garder en place les restrictions contre les visites. Ils n'ont pas mangé ensemble. Alors, ça va rester en place jusqu'on reçoit un deuxième test négatif. Et puis, on va aussi faire les tests si n'importe résident ou employé devient malade.
Merci.
Any additional questions?
Hi, Dr. Morrison. Travis Kingdon here again from the CBC. The case from Nova Scotia who returned on the 29th, did that patient self-isolate upon return? And, how much concern is there that they were active and about in the community at that time before they got tested?
Yeah, so they were supposed to be self-isolating because they had returned from Nova Scotia, and certainly that was prior to the bubble. So their contacts were very limited, and they, as I mentioned, they had 5 close contacts identified, and those are the ones that we tested yesterday, and 2 came back positive. So.
Final question.
Is the Premier there?
Yes. He's waiting for a question.
Sorry,
He's waiting for a question.
I couldn't see you there, Dennis. Has there been any discussion with your fellow premiers since the new cases? Sorry, Dennis, it's Jason from The Guardian. Has there been any discussion with your fellow premiers with our new cases since yesterday, given that the bubble is just opened?
I haven't talked to any of my Atlantic colleagues directly since our announcement yesterday. We've been just working through our public health offices to undertake the contact tracing, and that has been going very efficiently, and it's been impressive how efficient and effective that process has been. I would say that a couple of times that we've talked about that the cases here predate the bubble, and as of right now, we will just keep working on the situation we have here at hand, and allow our public health officials to undertake the jobs that they have to do. And until such time as there would be a need for us to have a conversation at a higher level, we will allow through our epidemiologists and through our public health officials for that process to take place. But I'd like to just add that I think that if Islanders had grown a little bit comfortable with the fact it was 65 or 67 days in between, that our incredible staff at health and public health remained vigilant and remained alert, and just grateful for the effort to date, and thank them for their professionalism. Well, thanks very much, everybody, and chat again soon.